Managing fluids for the child in shock. Shock is a life-threatening condition that causes the body to shut down, losing the ability to perform its most basic functions. Usually, shock is initially treated with IV fluids given rapidly. However, too much fluid can be dangerous for children in shock who have severe malnutrition, severe anemia, or fluid overload. This video will show how to safely manage a child in shock. Wear gloves and a mask to protect yourself from infection. First, determine whether the child is in shock. Check for cold hands, a fast, weak pulse, and slow capillary refill. If the child is in shock, check for severe malnutrition. Is the child extremely thin or have edema in both feet? Check for severe anemia. Are the inner eyelids pale? Is the patient's palm more pale than your palm? Check for fluid overload. Look at the chest for fast breathing and listen for crackles in the lungs, the most sensitive signs of fluid overload. Next, give IV fluids if there are no signs of severe malnutrition, severe anemia, or fluid overload. Give a bolus of 10 to 20 milliliters per kilo of normal saline or lactated ringers over 30 minutes. Reassess the child after the fluid bolus by checking the pulse and capillary refill. If there is no improvement, repeat the bolus, giving 10 milliliters per kilo over 30 minutes. If the child in shock does have severe anemia, severe malnutrition, or signs of fluid overload, give fluids with added glucose, 10 to 15 milliliters per kilo over 1 hour. Check for signs of fluid overload every 5 to 10 minutes while the child is receiving IV fluids. If the child shows no improvement in the signs of shock after 1 hour, give a blood transfusion, 10 milliliters per kilo, slowly, over at least 3 hours. Remember, be cautious in giving IV fluids to a child in shock who has severe malnutrition, severe anemia, or fluid overload. Look for signs of overload and stop fluids if they occur.